Hello everyone, I'm Dr. Julian Escobar at Conceive Fertility Center. This is PCOS month, which stands for Polycystic Ovarian Syndrome, which basically means that your ovaries have a lot of cysts, but they're really not cysts, they're follicles, which are little nests that house an egg. And the standardization is that if you have more than 12 per side, that's called polycystic. So you have a lot, so you're a lady with tons of eggs. The syndrome becomes when you have other things associated with it, like irregular cycles, or increased male hormone, like increased hair, or by testing you have high testosterone levels. So when you put them together and you exclude other causes for it, you may come up with that diagnosis. And patients come to us at a fertility clinic mainly because they're trying to get pregnant and they're not having periods. So then we work them up on that side. However, PCOS is a complex process. Some patients are born with PCOS and they can be very thin and have PCOS. However, many patients are borderline. And so what happens is as they gain weight, they go from polycystic to polycystic ovarian syndrome, meaning they start growing more hair and they start having more irregular cycles. So a big part of it is looking at the entire picture, and often moderate weight loss can help the patients go back to a more normal cyclical pattern with diet and exercise. We look at their sugar levels, make sure they're not pre-diabetic. Other things can be associated with it, like high cholesterol levels, which we also see. And then from the uterine or endometrial side, we pay attention to that also, because if you're not exposed to progesterone, which you're exposed to progesterone after you ovulate, then you start accumulating cells that are not being recycled, and they start mutating, and you start getting precancerous cells. So we also tend to evaluate your cavity for that, and also for polyps, which can also develop over time. So polycystic ovarian syndrome includes many different factors: ovulatory factor, like we said, increased hair growth, infertility, irregularities of the uterine cavity, and either associated with things like prediabetes or diabetes or high cholesterol. I hope this helps. Take care.